So we've been getting a lot of questions about who should get tested for COVID-19, and I think this is important. Right now, UW Health is not testing asymptomatic individuals. So if you're worried that you may have come in contact with someone with COVID-19, but you're not having any symptoms such as no fever, no cough, no shortness of breath, we wouldn't test you at this time. We do have some preference to test people who have either traveled internationally to areas where we know there's community spread of COVID-19, and we're looking at individuals who have traveled domestically to areas that might have community transmission, and they would be more likely to be tested, if they had symptoms such as cough, fever, or shortness of breath. The other issue we want to talk about a little bit is where can you get tested? I think that's a concern on everyone's mind. UW Health has some testing locations and they're developing more options for testing. Right now, we are trying to get people to the right testing center based on the specific conditions that they call and let us know that they have. So the best way to figure out where you can get tested is to either call our hotline, call your clinic, or send a MyChart message to us, and we can help figure out whether or not you need to be tested, and if you do need to be tested, where that might happen and when that might happen. We do have some instances where the number of patients we want to test exceeds our ability to test them that day, and we have been telling some individuals to self-isolate at home and we'll test you over the next 1 to 2 days. The other message that's really important for the community to understand is that if you think you need to be tested and you were to present to an emergency department or urgent care, unless you're having an emergency medical condition, it is very likely that they won't be able to test you if you just walk in. We're trying to be very good stewards of this limited resource to test people in the community that we know that would provide the greatest community good. So it's not that we don't want to be able to test everyone, but right now that's not a possibility. So if you want to be tested, it's really important that you call ahead first, either to our hotline, to your clinic, or leave a MyChart message.